So wisdom teeth or akkal dad, no, basically, they tend to erupt a little later in life, maybe by about 17 to 25 years. They're basically the last set of molar teeth that we get in our mouth, one in each corner. Now, because they erupt a little later in life when we're supposed to be wiser, that's why they are called wisdom teeth. Wisdom teeth basically, no, we have evidence of them growing in on x-rays for children as young as 6 to 10 years, but we don't get them in our mouth while we are about 17 to 25. Now, what has happened is basically, as we've evolved as a species, our jaws have become slightly smaller because our diet has changed. Now, because the jaws have become smaller, there is not adequate space to accommodate all the teeth in the mouth. That's why usually they tend to get stuck or they erupt in an unfavorable position. Now, if that is a scenario, that's primarily the reason why they tend to hurt when they erupt. You will probably see a small bud erupting in your mouth. You might be able to see a small peak of that white tooth coming in. Otherwise, what you may also feel is little pressure or pain in the back of your mouth. It may get slightly swollen. You may have little difficulty opening your mouth, or there may be some pain which can probably radiate towards your ear or maybe towards your temples. So, not everyone will need wisdom teeth removal. If they've erupted in their place and if we are able to maintain them very well, like I said, because they are right at the back, it is very difficult to keep them clean. If only they've erupted in an unfavorable position or they've gotten stuck in the jaw, which we also call impacted. Now, if they are impacted, they may cause some problems. Some being that they might put a little pressure on the tooth ahead. And if they've erupted in an awkward position, they tend to become a food trap. And again, if there is a gum flap on top and there is always food getting stuck, the infection may need its removal. In very, very rare scenarios, there are some cysts or some bigger infections which may develop around them, but that's a rarity. So that is primarily the reason why you may need wisdom teeth removal, but it's not for everyone. Prevention is the best form of cure primarily here. But otherwise, if you feel that there is some pain, what you may do is primarily some warm water salt goggles that will help gently cleanse the area. Even if it is tender, we recommend just try and gently brush that area so that any debris, if there is left, that can be cleaned off. If there is some tenderness around the jaw, some swelling or difficulty in opening the mouth, you may use some cold compresses on the outside that may help. But we would again recommend don't hold on to this. Don't try to prolong your home remedies for a very long time because the problems may be more. It is better that you get in touch with your dentist first to figure out what exactly is going on. And so then they can decide or advise on what the next plan of action or your treatment should be. So, here what we say is if you're in pain, you're already late. Trust me, if you go and just say hi to your dentist every 6 months, you and your dentist both will be much happier to see you without pain than to see you suffer. But having said that, if there is already that you're in pain, what you may do is you can just give us a call if you feel that the pain is lasting more than a day. If you feel that there is some pus discharge or bad taste in the mouth, if you feel there is difficulty opening your mouth, or if you have a fever, just make sure that you get in touch with the dentist immediately.